Good morning, everyone. I'm Muriel Bowser. I'm the mayor of Washington, D.C. I'm joined today by LaQuandra Nesbitt and Chris Rodriguez, the directors of the Department of Health and D.C. Homeland Security. We will provide an update on the district's response to COVID-19. We have a relatively short presentation today, and then we will take your questions. Let me start with our numbers. I'll remind DC residents and businesses that you can go to coronavirus.dc.gov for a daily update on the district's experience with COVID in 4 buckets: the level of community spread, our health system capacity, public health system capacity, and community engagement. You'll notice that we are headed in the right direction with our daily case rate. Our positivity numbers also improving, and we want to call the public's attention and remind them, if you get a call from DC Health, to answer the call, and please cooperate with our contact tracers, because we have right now one of those community compliance numbers in the red. I also want to share our most recent vaccination data. The number of doses delivered, the first doses administered, and I understand that DC Health, beginning next week, will not just report first doses delivered, but also report first and second doses delivered. Let me turn to how this week's doses will be delivered. You notice that there are 27,140 doses that the district has received. That's apart from doses that are delivered in the district that we don't receive. But the doses that we receive are 27,140. They will be distributed to the Vaccinate.dc.portal, to hospitals and health centers, as well as to special initiatives and partnerships. You can learn more by going to Vaccinate.dc.gov. We also want to provide a quick update on our pre-registration. As you are aware, DC residents and workers can pre-register for vaccine. We prioritize according to the following buckets: people in priority zip codes who are over 65, followed by all residents over 65, people in priority zip codes with qualifying medical conditions, followed by all people with qualifying medical conditions. And the last buckets involve essential workers in zip codes that are priority zip codes, and then all zip codes. And so you can also see the number of invitations that go out, the number of booked, and subsequently all of those who follow through with those vaccination appointments. This morning, according to our regular cadence, we sent out invitations according to those priorities. 19,410 invitations went out, and we will book those appointments accordingly over the next several days. In addition, people who have already received an appointment, in addition to those who have already received an appointment, over 177,000 have pre-registered for a vaccine and are awaiting their appointment. Yesterday, we also announced a new partnership with CVS that is going to focus on teachers and school staff, child care workers, healthcare workers, and DC residents over the age of 65. This is a 2-step process. First, pre-register through Vaccinate.dc.gov, and then you will actually book your appointment through the CVS website once you receive an invitation. So over the next 7 to 10 days, just over 3,500 doses will be made available through this partnership. Let me remind all workers in those priority employment groups. These are DC teachers and school staff, DC child care workers, healthcare workers, and DC residents over the age of 65. We also continue to provide vaccine for faith communities who are participating in a special initiative called Faith and Vaccine. The faith communities indicate that they will reach out to their communities, their parishioners, to help us reach vulnerable communities. To make sure everyone in DC has access to the vaccine. To date, just over 2,000 people have been vaccinated through the Faith and Vaccine. So this, on Wednesday the 24th and Friday the 26th, actually that's this week, the First Baptist of Minnesota Avenue on Ward 7 hosted an event, and will host one on Friday. And the Pilgrim Rest Baptist Church, also on Ward 7, will host events for their parishioners and neighbors on March the 29th and Tuesday, March the 30th. I will display the current list of eligible DC residents and DC workers. You can go to our Vaccinate.dc.gov website to carefully study that. And you should pre-register. You can pre-register at any time. And when it's your turn, you will be entered into the randomized selection according to your priority group. And next week, we'll also have some new populations that become eligible. People working in non-public transportation service like rideshare, individuals working in logistics, delivery, and courier services, essential employees working in media and mass communications. So please pre-register so you will be included in the randomized selection according to your priority group. You can go to vaccinate.dc.gov, or you may also call 855-363-0333. We also want to make you aware of a change in test location. The Geico Garage at Nationals Park is going offline as a testing facility, but continue to go to coronavirus.dc.gov to find out where you can get a free COVID-19 test. Let me also make a couple of announcements about our recovery. Yesterday, we announced $2.2 million in Great Street Small Business Grants that are going to 50 local businesses. These are competitive capital improvement grants that award $50,000 to qualified small businesses. So congratulations to them. Further, we're announcing nearly $800,000 in robust retail grants to 106 local retailers that have an open brick and mortar retail location in the district and have 25 or fewer full-time or full-time equivalent employees. So this is another tremendous effort to provide a bridge for our local businesses who have suffered losses during this last year and are doing everything possible to stay open and keep their people employed. So please make sure you go to coronavirus.dc.gov and look under recovery for all of the programs and services that we are offering. So with that, we can take some questions. Questions? Yes, Mark.
Good morning.
Good morning.
On Nats Park, is that closing because baseball is coming back or because there's not a need anymore?
It is closing because, yes, they're going to use their facility, which we anticipated it not
So
being
it's because of baseball?
Yes.
And then, can you tell us just where we are, maybe the doctor, where we are on testing, and if we're doing as much testing as we were before, or is there a sense, and is it right or wrong, that maybe testing isn't as important now that everybody's lining up for vaccines?
Chris, do you have the latest? Can you provide the latest on testing?
I don't have the specific numbers in front of us, Mark, but what we have seen over the last several weeks is a steady sort of decline in the number of folks who are presenting for at our mass testing sites. So we'll continue to monitor that, and should there be a change in our posture, we'll make recommendations to the mayor at that time.
And I'm just wondering, or maybe Dr. Nesbitt can answer this, is that what you want to see? Is it more, is testing less important now, or would you encourage people, or are you What is your thoughts on the fact that we're seeing less people getting tested?
Well, I think, Mark, you know that testing has always been individually independent, right? So there are different circumstances under which we have continued surveillance programs. For example, in our long-term care facilities, we continue to encourage educators to be tested with a routine level of frequency. So despite vaccination status, those surveillance programs in our healthcare facilities should still continue. As Director Rodriguez mentioned, we are around, on a weekly basis for the past couple of weeks, around 35,000 or so tests, which is what we were seeing before the holiday season when the number of tests got up to 50,000 plus. We've also seen an increase in the last week or two of our positive cases who are reporting a history of travel. As you know, we do recommend that people be tested before and after they travel. And so those types of testing requirements are still there. So testing is still important. There are still very many unvaccinated individuals in the District of Columbia and the country as a whole because we don't yet have enough vaccine for everybody who wants a dose. So until we have that place where we have a huge proportion of our population that is vaccinated, we will continue to recommend testing as a way for us to quickly identify new cases, contacts to new cases, and quarantine and isolation where necessary.
So can I ask about your mayoral order that seems to step back from encouraging work from home? And what is exactly your message now as far as should the private sector feel more comfortable about going back to work? And what about the federal government? Would you be giving them the all clear to come back to work?
We are encouraging everybody, all employers, to think about how they are implementing their return to work plans. And phasing their employees back to work. DC government has been undergoing that exercise, and we will continue to undergo that exercise, and we want all of our private sector partners to do the same. People, I'm sure throughout the last months, have been looking at their spaces, looking at their employee needs, and making those plans. We're also very supportive of the downtown bid and the Golden Triangle bid and the Federal City Council, who are reaching out to their property owners and businesses, asking them to sign on to the Return to Work pledge. Do they have a plan? What is the plan? When are they coming? How are they communicating with employees and the like? So I think I answered your question.
Would you like to see the same path, the same trajectory of the federal government starting to make plans to come back to work?
We want everybody to have a plan. Now, it will be different for different needs. You know, different businesses are all not the same, and so we don't expect a kind of one-size-fits-all plan for everybody. Sam.
Yes, Mayor. I don't know if this is for you or for Dr. Nesbitt. But,
Okay.
As I understand it, the CDC is looking at I guess the number or percentage of vaccines into arms, and DC is near the bottom of the list, below everybody, but Alabama, Georgia, the territories, way below Maryland and Virginia. What's the deal there?
I think that we've talked about this kind of ad nauseum about some discrepancy, quite frankly, between the number that the CDC has reported and what we have. So what I'm going to work with DC Health to do and put in one single letter to the CDC where we think their numbers are off. So we report, as I indicated earlier, the number of doses that the jurisdiction, us, DC, has requested. There are also doses in the CDC's total number, I'm told, that reflect what the government sends directly to federal entities, which we can't account for. They aren't accounted for in our number. And then there are the special programs that the federal government has where it distributes vaccine directly to healthcare providers, which we also, we don't know exactly how those are being reported back to them. And in addition to that, we think that there's just a discrepancy in the number, even accounting for all of that, with the total doses distributed in those 3 types of ways. So we're going to get it all in one format, Sam. I will communicate to the proper entity where we see the discrepancies and request their immediate corrections.
Can I ask an off-topic question?
Sure.
Tragic situation near Nats Park the other day.
Yep.
Where it appears 2 teenage girls were arrested for allegedly trying to carjack an Uber Eats driver. It resulted in his death. And I understand that there's a number of these instances going on in the city. Somebody gave me some guy in Capitol Hill was putting his groceries in his house, and some kids drove up and took his car. You know, is there anything that can be done? What are your thoughts about this?
Well, it's more than tragic. I don't even know if that word describes what happened. It's senseless. We have very young people involved, and we have a person who's just trying to make some money, I'm sure, to support his family who died. So there really are no words to describe how heinous and ridiculous a situation that is. And you have several people whose families, I'm sure, are destroyed by what happened. Several weeks ago, I know Chief Conte spoke to you about the carjacking task force that he has pulled together. That includes from federal partners and regional partners. They've also made some pretty significant arrests in recent weeks, and consequently, we have seen some of those numbers go down. We also talked to everybody about looking out for each other, for not leaving vehicles running, for reporting suspicious activity, because it's very important that we find out the people who are responsible for these carjackings, and that we have justice. So we'll continue to look anytime you have young people involved, and you know I can say very little when it comes to juvenile crime. But when we have young people involved, we want to know if we can identify some root causes and prevent or help those situations as best we can.
The fact that there's a COVID, it's not exactly a total lockdown, but a lot of the facilities where young people use don't seem to be functioning these days. Is any concern about maybe having more for them to do?
Well, we've always had concern for having more for them to do, and you know that we're going into this spring and summer with eye towards as many outdoor activities available as possible. But keep in mind, I want everybody to keep in mind that DPR has been pretty active throughout this COVID emergency. We're going to see more activities related to schools, certainly with DC public schools, and I'm calling on the public charter schools to be active with their students as well.
Finally, for me, Mayor, I don't know that this is going to be a part of the president's speech today, but there's some talk that perhaps he will be talking about banning ghost guns. What are your thoughts on that?
Well, our law already deals with ghost guns, and we are ghost guns, assault rifles. This country having common sense gun laws, we're way past due for that discussion. We've seen in the last week or so tragic mass shooting, but we've also seen in cities and towns across America urban crime that's taking too many young people and destroying too many communities. So we have a gun problem in our country, and we need some immediate serious action. Now, I won't pretend to be optimistic about that. I think we've seen too much huffing and puffing after incidents and no action. So we need national action on guns.
know, for example, here in DC, if you look at the report that the MPD puts out every week, you see there are ghost guns involved. And these are guns with no serial numbers. I guess that somebody just put together.
That's correct.
So, I don't know, do you think
Yes, I do. Yes, I do. Yes, ma'am.
Good morning.
Good morning.
My question to you is about the Senate's introducing a bill tomorrow to prohibit congressional fencing, permanent congressional fencing. I was just curious, what are your thoughts on that bill or any measures to prevent the Capitol from having permanent fencing? And additionally, you were on the Hill just Monday. Your thoughts on the hearing that you participated in?
Sure. I haven't examined that bill, so I won't comment on it specifically. But I have talked here before about surely understanding the needs of lawmakers to be safe at their workplace, and being very hopeful that they're going to study ways to do that without closing off the Capitol with an impenetrable fence. So I will pay some close attention to what's moving in the House on that. And I would generally associate myself with the comments that our Congresswoman has made, because she has been taking the lead, as she should, on those discussions for us on the Hill. In terms of the hearing, I think that it's been well discussed that the arguments against statehood are thin, and the Republicans on House oversight made no attempt to mask what their opposition to DC statehood is really about. And we want to make it very plain that it is past time, that the 220-year wrong of not having representation and autonomy in the nation's capital has to be corrected, and has to be corrected now. I'm encouraged by the strong statements that we've seen from Senator Schumer, who will have a strategy in the Senate, as well as the strong support of President Biden. I think both will be key to H.R. 51's success.
Thank you.
Yes, Perry.
Yeah, thank you. Good morning. Quick question about vaccines. The 3,500 vaccines for school workers, healthcare workers, the 65 plus, is that in addition to the 20% set aside for essential workers and the set aside for seniors? Yeah. It is in addition? Okay.
That's correct.
And last week, the city officials said that an announcement on cohorting and social distancing could be expected this week following the CDC guideline. Has DC Health decided yet whether they're going to go with CDC and say 3 feet of social distancing in schools versus 6 feet? And if not, what are we assessing still?
We expect that guidance will come out shortly. There are some. I had some remaining questions, so as soon as we're done with that, they will come out. And I will just say that it will lay out all the risk associated with in-person learning, and we will address 3 feet and 6 feet social distancing in the context of our COVID experience.
May I ask, what are the remaining questions that you have about this? What was
I had a question, some timing about how schools report to us and the mechanism by which they report to us, and how we describe what level we are in with COVID transmission.
Okay. And last week, or maybe the week before this month, Dr. Nesbitt, you said that schools with caution could mix cohorts, meaning middle and high schoolers could switch classes. My understanding is that DCPS is not adopting that guidance for this academic year, that they're going to stick with not mixing cohorts. So my question is, I know the city administrator said there's not going to be a huge expansion of middle and high schools for this academic year on the council call yesterday. What can middle and high schoolers expect this academic year? I mean, are kids going to be, I know there's intervention programs right now going on, but are middle and high schoolers going to get to go to in-person school this academic year? And what is the rationale for the school system to not adopt this guidance?
Well, the school system hasn't indicated what it's adopting or not adopting.
I believe they have said they're not adopting the cohorting rules.
Okay, well, we'll have them get back to you. Okay, what's next?
Hi. I understand that you expressed interest in FEMA's pilot community vaccine center that would have gotten us an increased supply, but we're told we would be ineligible. And so I wondered, did FEMA indicate why?
I had expressed interest in what?
Yes, FEMA's pilot community vaccine center. That one would have gotten us increased supply. I know that FEMA also does things where they help us with personnel,
Okay.
et cetera.
I want to ask Chris to respond.
Yeah, thanks, Amanda, for the question. As you know, we late last year asked and requested of FEMA to be part of its pilot program for community vaccinations. That program was ultimately, DC was deemed ineligible for that program for a variety of reasons that FEMA has defined some of the jurisdictions population-wise, social vulnerability index, as you know, and we did not meet that criteria. We were told that we were denied. We then, and I know the mayor worked with the governors of Maryland and Virginia to request additional support in vaccine doses for federal workers. Once again, we were denied that request. And so I think it's important to note that the community vaccination program that FEMA is rolling out has very specific requirements, and we just confirmed with FEMA yesterday that DC is still not eligible for that program, but we will continue to advocate in our bi-weekly calls with FEMA leadership to make sure that we're getting the vaccine doses that we need. And I think it only underscores the importance that the district needs more vaccine. We have, as DC Health noted on the call yesterday, we do have the infrastructure and logistics to support the distribution of the vaccine. We just need more doses.
Thank you. And then returning back to the telework, the telework guidance. I guess my question is, why did you decide to drop that encouragement up to telework for non-essential workers right now? I know some workers are anxious. They're still seeing these two metrics in the red. And then they also know that, they'll be eligible come May for a vaccine. And so I guess, can you just clarify the timing for that?
My experience shows me that you just don't turn on and off activity, right? So we know that it is safe to be in workplaces. A lot of my employees are in workplaces and have been in workplaces throughout. And we know a lot people are and will continue to be vaccinated. And we want to make sure people know that they should and can come back to their offices. I don't expect that our mayor's order means that people are going to flip on the lights tomorrow. In fact, I know that it takes a lot of work to communicate with your employees, to make sure your facilities are ready. It sometimes takes, as we have learned in schools, to have people actually come in. Some people haven't been in their office in a year. So they want to come in, they want to walk around, they may have an open house, they may have a training. So they want to test out their transportation. So there are a lot of things that people are going to do as they phase back into the office.
Question on unemployment. I understand this is for the third time now that people are struggling to file for unemployment benefits because of a systems update. And I believe that the DOES director said this time it's going to take 3 weeks to resolve. I guess, can I get your reaction to that this is continue to be a problem every time?
Well, it continues to change, right?
Yeah.
So as the program, I don't know what to tell you. If we have to update because the program has changed, it's probably had, I don't know. I don't even know how many program changes that they've had in the last year, but a lot. We recognize certainly that people need help. They need the benefits that they're entitled to. And I recognize that my team, who's taking calls, who's handling claims, who's working with vendors to update the system, are also doing everything that they can to make that quicker and smoother and better communicate status, because that's what I know is very important to people, that they know where they stand and they know when any issue for their claim will be resolved. So we're doing everything that we can to make sure that we keep those lines of communication open and get the people the benefits they're entitled to. Yes, ma'am.
Yeah, there's some conflicting messaging going around about what fourth quarter could look like. I know yesterday on the council call, the city administrator said that he was very optimistic there will be a significant portion of the demand met for in-person learning at the elementary level. The chancellor at the town hall yesterday was a little more modest and didn't go as far as saying that, but the elementary school principals that he had presenting, they each said they were only adding something like one classroom for the fourth quarter. So what is it? What can parents expect for fourth quarter? I know the guidance hasn't come out yet, but are you pushing for a big expansion, or are you for fourth quarter for in-person learning?
We're not, I'm not going to talk about fourth quarter right now. Perry? Yes.
I'm referring to the council call yesterday. Dr. Nesbitt, I'm wondering if I heard Dr. Shaw correctly. He was asked about the total percentage of doses that have been administered to out of non-DC residents, and I believe he said it was about 50%. Can you tell, did I hear right, or what percentage of to date doses administered have gone to non-DC residents?
I mean, is that on our coronavirus?
It is. It's
on
our
our
website,
It's on our
Mark.
website. You can
And the
refer
number,
to that.
if you review it weekly, you'll notice that percentage continues to decrease.
Is it about half?
It is not. It's lower.
It's lower than that?
Yes.
Okay, thank you.
But
And you can
encourage you to
also,
look at the
let me
website.
just say something else, because a number of the questions that have been asked today are kind of, you see the kind of tensions and trade-offs involved in everything that we're doing. I got one question to say, why aren't all the kids in school? Then I get another question to say, why are you telling people to go back to work? Like, which one is it? Should everybody go back to school, the teachers, the staff, and none of the office workers? And then we get a question, well, is this non-DC residents? But then I get a question, is this additional vaccine for childcare workers and teachers? Well, guess what? Half of them or more don't live here. They don't live in DC. They live in the region. So if you want teachers and childcare workers vaccinated, then that means that not all your doses are going to DC residents. So I just wanted to point out that there are a lot of competing demands and tensions about how we will proceed in reopening. And I just think it's interesting that all of the, just in those two cases, for example, those tensions and trade-offs are kind of laid bare. But I am very confident in the work that my team is doing in communicating and getting out the best information that we can. But if a resident asks, why are non-residents getting DC vaccine, it contributes to another question that I get, is how do we get more kids back in school? Because our teachers and childcare workers are not all, in fact, more than half probably, are not DC residents. And then that contributes to Amanda's question about people's anxiety about coming to work, because they want to know that they're going to have safe child care and that their child care workers are vaccinated. So those are the trade-offs that we deal with every day in this emergency response. And I thank you for your questions.